When Jane was prescribed opioid pain medication for a back injury several years ago, she never thought it would put her on the edge of a very slippery slope. Taking her medicine as prescribed was helpful for her pain, but over time, she started to feel like she needed more to keep her pain under control. I could take just a tiny bit more of my recommended dose, she thought. It's a small amount. It would just be like taking one more aspirin for a bad headache, right? If Jane chooses to increase her dose without direction from her doctor, she could be on a very slippery slope to more dangerous alternatives. One increase could lead to another increase. And by the time Jane's doctor decides she should be feeling better and no longer need a prescription for pain medicine, Jane could be hooked on the way the increased dose of pills make her feel. Let's teach Jane about opioids. What are opioids? Opioids are not just pills. Opioids are drugs that block pain signals to the brain. They aren't made for long-term use, and they can have very serious side effects. The more you use them, the more your body can build a tolerance. Commonly prescribed opioids include hydrocodone, oxycodone, codeine, morphine, and fentanyl. Heroin is also an opioid. Why are opioids dangerous? Opioid medications can be addictive. Research suggests that abuse of prescription opioids may actually open the door to more dangerous drug abuse, such as heroin. Overdosing on opioids can happen by accident. Opioids can be dangerous if you take high doses or combine them with other medicine or alcohol. Avoid mixing opioids with sedatives or tranquilizers, like Xanax or Valium, muscle relaxants, like Soma or Flexeril, sleeping pills or hypnotics, like Ambien or Lunesta, and other prescription opioid pain relievers. If you're prescribed an opioid, you should be given the lowest possible dose for the shortest possible amount of time. Opioids can cause serious side effects. These can include constipation, nausea, vomiting, dry mouth, sleepiness, dizziness, confusion, and increased sensitivity to pain. Follow up regularly with your doctor to monitor how the medicine is working, any potential side effects you might feel, or signs of an opioid use disorder, like addiction. Are there alternatives to using opioids? Long-term use of opioids can be appropriate for some patients, but for many other patients, pain can be successfully managed with non-opioid options. These options could include exercise and strength training with your doctor's guidance, rehabilitation, relaxation, and physical therapy, non-prescription pain relievers such as Tylenol, Advil, or Aleve, massage, chiropractic care, or acupuncture from a licensed practitioner, or other prescription medicines or treatments such as steroid injections. What should I do if my doctor prescribes an opioid? If you are prescribed a prescription pain pill, ask your doctor these questions. What's my risk of becoming addicted to this medicine? Does this prescription interfere with any other medicine I'm currently taking? Am I taking the lowest dose possible for the shortest amount of time? If I take this medicine, what should I do when I'm ready to stop? Are there other non-opioid medications I could take instead? Are there other treatments I could try instead of medication? Now that Jane knows more about the risks of opioids, she decides to step back from the edge of that slippery slope. She talks to her doctor about her medicine, and together they come up with a solution to address her pain without prescription pain medicine. Remember, your doctor is your partner in your pain treatment plan. Don't be afraid to discuss your medicine with your doctor. To learn more about prescription opioids and how you can manage your pain, visit www.qualityinsights-qin.org.